So at Chevron, we define forward a very holistic approach towards health. It's starting with our programs around HIV/AIDS, malaria, tuberculosis, and going and expanding those programs over to non-communicable diseases, which along with cardiovascular disease are diabetes, stress, sleep disorders, obesity, and many other areas where the risk factors are similar, but they're all preventable. Our efforts around HIV/AIDS and malaria are now expanding towards prevention of transmission from mother to child, and Chevron is very dedicated and committed on our efforts around PMTCD. We're making, in Chevron in the last few years, we've made tremendous effort to prevent this transmission, and now we can report that in countries like Angola, we haven't had an HIV baby born in the last 7 years, and 11 years in Nigeria, which is a huge success story for us. So one of the examples in the areas of cardiovascular disease and our efforts around HIV/AIDS, malaria, and tuberculosis is the work we've done in Nigeria. We are working with 10 to 12 small to medium-sized companies to develop these peer health educators. These health educators are our effort for making sure that the communities are aware and they impart education around these diseases.
So when you look at the World Health Organization data and you see the impact that cardiovascular disease has on a global level, the impact is disproportionate in medium and lower income countries, and especially in areas where Chevron does business. It's the #1 cause of death. And when we look at our Chevron data, we see that our work population has some of the same public health concerns: inactivity, poor nutrition, overweight, high blood pressure, cholesterol, stress. All of these impact cardiovascular disease, and it really made good business sense for us to focus on that. When you also realize that with an aging population and Chevron as a long-term employer, our commitment to our employees is significant. And so it just made sense for us to focus on this unique global challenge and to make cardiovascular health our area of focus for our public health efforts. Our program is actually centrally coordinated, but we've made a big effort to have a local control of how things are implemented. So we have some core capabilities, for example, a risk assessment and access to tools and resources available either online or on a paper-based format. The local groups are then able to take that information and implement it in a fit-for-purpose manner. Where there's a robust local medical system, we act more as partners to complement those efforts already underway. In areas where they are now beginning their journey around addressing cardiovascular health, we focus more on education and awareness. So really, our approach has really been to have some sort of core capabilities and then making sure that the local teams are able to adjust it to make it to help us make it culturally relevant and to make sure that it's fit for purpose for that environment. So I'm a nutritionist by training, and so for me, I see nutrition as being a real core part of as we try to decrease most chronic diseases: cancer, cardiovascular disease, diabetes. All of these have very strong links to nutrition. I get a little bit of a bad rap at work because I'm always checking out whether our food is appropriately healthy, but I really do think that that's one of the main environmental areas where a company can really help influence not only its employees, but contractor staff or anyone who comes into our facilities where we provide food. And so for me, seeing us grow from having minimal healthy offerings to a state where all of our cafes and cafeterias have at least some healthy choices, that's for me is a big passion of mine in the fight against chronic diseases like cardiovascular disease.